Now, a person under investigation is someone who has acute respiratory illness with sudden onset of at least one of the following: either cough or sore throat, shortness of breath, or fever. Fever could be measured, which is objective, or history of fever. People say, look, I've had a fever. That should also be considered. So this is when you now decide to suspect at working in the facilities. When you deal with community tracing out there, they will look at two signs, two symptoms, not one. When people present to a healthcare facility, it is one. I think that was clarified yesterday, and we can also emphasize today about it. So persons at highest risk are those who have acute respiratory illness and who in the 14 days prior to the onset of symptoms met at least one of the following epidemiological criteria. Is either they are close contact. When you have this slide, you click to the notes, you will see definitions of all this clearly put there. But the close contact is someone who's been in contact with a confirmed person. Confirmed person means somebody whom the laboratory has, confirmed that they have SARS-CoV or COVID, or probable will be where people have symptoms, they present a clinical presentation of SARS-CoV-2, but the laboratory is not confirming. That can still be called probable. But also history of travel is important. I think at the beginning, this was probably the one most important criteria, but at this point in time, it is changing, but people are still moving around. We mustn't make that mistake of thinking that everyone is locked down. Those who work in an environment where there have been cases reported, like we hear now and then, or those who are admitted with severe pneumonia of unknown etiology, these are people at highest risk, and we need to be taking samples and examine them.